Hi, Mrs. Sanders. This is Jenny with Jordan Home Health. I'd like to come and see you tomorrow. Dr. Anderson ordered for us to start skilled services with you. I'd like to come and do your admission tomorrow between 10 and noon. Does that sound okay? Wonderful. Let's just double check your address and make sure I know where to find you. Is there anything I need to know about coming to visit you tomorrow? Any gate codes or dogs that don't like people? Wonderful. Well, this first visit will be lengthy. We're going to sign all of the consents and paperwork and make sure that you know all about the Medicare home health benefit. We're going to review all of your medications, talk about all the different doctors involved in your care so that I can communicate well with them. Wonderful. We're going to check everything out and make sure that all of our clinicians can talk to each other and know what's going on and how to best care for you. There's one thing I'd like you to have out at the kitchen table when I come tomorrow. I'm going to need to review all of your medications, even herbals, over-the-counter, maybe supplements, anything that you take ever, even every now and then. Could you have those out at the table for me when I come? And I'd also like to review any discharge paperwork that you got from the hospital. One last thing. I'd love to give you the phone number of our office. That number is answered by a nurse returning calls 24 hours a day. That's a great place to call if you have any questions, any concerns about scheduling, or even to talk to your office case manager. We have someone available all the time. Okay, take this number down. Thank you. Hi. I'd like to talk today about our starter care process and how life-changing it can be. There's two people you need to be able to talk to about this. You've got to be able to tell your patients in facilities, SNFs, hospitals, rehabs, going home, what's going to happen at that first visit. Helps reduce anxiety, also helps them kind of know what's going to happen and what to expect. We also need to be able to talk to our doctors and referral sources about the power and the magic involved in skilled services and all that we do in the home. Some people think that we do quick in and out visits and don't understand how all-inclusive and comprehensive and sometimes a little invasive it can be, all of the things that go into home care services. And I want you to be able to talk with pride and understanding of what your company does for people. So first off, that first visit, when it's done, it's about a 2-hour long visit that's opened by an RN. And then any other disciplines will come in either the same day or within the subsequent days following. Things like occupational therapy, speech therapy, physical therapy, aid services. Everyone that works on our team, not just you, uses a tablet. This technology is important. It's important for us to be able to talk about what it does. This is where we keep the patient's chart. And it allows real-time, in-the-moment communication with each other, with our doctors, with our office, with our scheduler. All of our clinicians are documenting their assessments, the tests that they're running and doing, the vital signs, any notes, any orders that need to go out. They're documenting in this tablet. We tell our patients that this is where we keep their chart and that this allows us to talk with other people in real time. It also allows our physicians to sign additional orders and all of their paperwork through our provider link, also in real time, and have some understanding of what's going on with their patients if they're interested in it. We'll talk more about that later. But at the starter care, the RN is going to call the evening before. We've been talking more and more about our conditions of participation and the rules that we follow to be good stewards of Medicare dollars, but also so that we have a great understanding and that we on the marketing team are the experts on what goes into Medicare home health for our patients. It is life-changing. We're not just looking at the here and now. We're looking at the total person. We're communicating with a care team that involves therapists and other clinicians and the physician. And then we're all working together to help educate patients and patients' families about how to handle chronic and progressive illnesses, as well as a fluke thing that happened yesterday. Our conditions say that we have 48 hours to see our patients. Here at Jordan, we have an amazing record of seeing our patients next day. The promise we must give is that we'll see our patients within 48 hours. Most of you involved in scheduling know that most of our patients are seen the next day. So the clinicians call the night before when they're making their schedule and make sure that they've checked things with their patients and that they're ready to be seen and that they know what that first visit's going to entail. The clinician, the RN, goes in and does all of the paperwork that explains the Medicare benefit. We explain homebound status. We talk to the patient about what's covered and what's not covered. There's some financial consents. We have a consent to treat. All of this happens before we even lay hands on the patient. We do a full, all-inclusive medication reconciliation. Those of you that have ever seen more than one doctor know how important this is. If our patients are getting prescriptions from their oncologist, their urologist, they see their PCP once a year for a physical, and they had a fall and went to the urgent care center, there's a lot of different people giving prescriptions, and in this country we have a major problem of polypharmacy sending people into facilities. So right there, this is something that is worth its weight in gold for us to be doing for our patients. And we don't just ask them what they take, and we don't go through just a listing that they got discharged with. We haul it all out. We bring out to their kitchen table all the supplements they get at Costco. You know they do it. All of their medications, PRN and otherwise, all of the things that they buy in Mexico or pick up somewhere else along the way, the antibiotics their neighbor Tom gave them. You know this happens. And we're checking it all for safety in our state-of-the-art equipment. We review all medications. We make sure they understand what they're taking it for and how much to take and when to take. If needed, we assist them in filling a meta-planner. We educate their families. A big part of the Start of Care process is learning all that we need to know about their financial status. Are they able to pay for their medications? Are they able to drive themselves or to have a ride transportation to the doctor's offices? Are they able to read and write? Are they able to read and write small print that's on the bottle? We review hearing and vision and resources. We look for opportunities to give them extra services. We look for whether or not they need social work to be involved. We talk to them about their preferences for resuscitation. We talk to them about having a living will. All of these things are things that we're required to ask about and help with if needed. We look for compliance with flu shots. We look at compliance with pneumonia vaccines and help people to get those things if they need them. This is really important communication for us to also have available back to the hospital and to the physicians that are working with them. This one visit can do what years may not have done. They may not have ever had someone go through and review and discuss what all their medications are for, why they take them, how to take them, what they can and can't do when taking them. Teaching their son or daughter or caregiver about their medications, I've seen it have life-changing effects. The other thing we do is what's called a home safety eval. I've heard it called different things at different companies, but the bottom line is that we use TUG testing. Have you ever seen TUG? It's the timed up and go. It's a standardized way to measure their risk to fall, and it helps us to measure their improvement. And it's across the board recognized in different realms. That's why we use it. It gives us kind of a baseline at that first visit. We also go through and look at all of the different ways that they are able to take care of themselves in their home. And we look at how they get in and out of the bed. We don't ask them, we ask them to do it. In and out of the shower, in and out of the car. These things are really important to their ability to stay in the home to remain independent and as healthy and as happy as possible. Our nurses complete an OASIS data set. You've heard people use the word OASIS and wonder what that means. That is a several hundred question data set that's required by Medicare. That's, again, universal, used by everyone. It helps us track our outcomes, but it also makes sure that we're reviewing everything from incontinence to risk for skin breakdown, risk for fall, the need for additional services, some red flags. There's some risk stratification involved in the OASIS data set that helps us to take better care of people. So all of these things happen at a start of care and come in with a summary from our nurses that's then able to be seen and shot out to anyone else that goes and does a visit. So when our physical therapist goes, they can see the things that the nurse documented and worked on. Vital signs can be tracked. Our technology allows a red flag to go up when things have changed outside of parameters. Even wound scoring. They have a wound on Monday that's a lot worse on Wednesday. Our technology allows us to identify that quickly and forces us to take action. So technology is something we want to brag about to our physicians and our referral sources, but we also want to be able to talk about what happens at the start of care. If you haven't been to a start of care visit, I would like for you to. Let's plan a ride out and plan to be there for 2 or 2.5 hours like our nurses are. And see what goes into it and how life-changing it can possibly be. If you think about all of our patients that are on service for months and some even years with progressive and chronic conditions, I want you to stop and think about the ones that 2 or 3 weeks of services might have completely changed the course of their illness and their life. If you can think about having a skilled provider come into your home 3 times, 4 times a week, maybe once or twice with a nurse and a couple times with a therapist, coming in and treating you in your home with your bed, your dog, your kitchen, your medications, and teaching you and your family how to take care of yourself and how to let you stay at home rather than being driven into facilities and nursing homes. That's what we do here, and we're the best at it. And we're able to provide this for our patients, but our doctors need to know what we're doing. So if you haven't yet scheduled or you haven't yet done a start of care visit with one of our amazing clinicians, I want you to schedule that. And I want you to look at our admission packet and see that we spend time doing evacuation preparedness. We help people to know when and how they would contact people in case of an emergency. We have lots of requirements with the CDC and with Medicare that our information is tracked and available to see if we're compliant with some of the important pieces of public health. But I want people on this team to understand what we're selling and how amazing it is. And that it's not just about, although I'm very happy for your relationship with your physicians and that they trust you, I want you to know what you're selling and be the expert and know and believe and be able to talk with conviction about how life-changing it can be. Next week, we're going to be coming upon our 4th of July. So our word for the day, for the prize, is firework. Last week was electricity. Seems fitting that this week is fireworks. Well, I'm going to be spending some time in a couple of your markets this week and again next week. If you have any questions or you need anything from me, please reach out. But I want everyone to talk to one of our RNs and get some more of the lowdown on what happens at a start of care and go out and watch one. You will be impressed. Happy Monday. Have a great week. Bye.